I wonder if like the general population knows, because I get calls all the time where it's not really clear. So could you explain the difference and talk about the importance of, I mean, both obviously for us?
Well, the main difference between
Yes.
testing and therapy.
Mm-hmm.
Therapy, you are coming in usually long term to work on a problem in like a talk
Right.
therapy format, but the type of therapy that I do is usually pretty long term. And
Sure.
so that could be years. But usually you're building a relationship with your, between patient client.
Right.
Therapist is using some kind of skills or modality to sort of treat.
So back to assessment
Exactly.
though. So what's the
Yeah.
difference here?
Yeah. So assessment, well, and this is a little tricky because I do traditional assessment for diagnosis,
Sure.
right? Like a lot of times, traditionally, assessment is if you are looking to see if you meet criteria or you have the symptoms, right? That
Right.
sort of meet criteria for a specific diagnosis.
Right. And another way to say that is basically if you have the disorder at this
Yeah,
time.
do I have an anxiety
Yes.
disorder? Do I have post traumatic stress disorder, ADHD, attention deficit hyperactivity disorder? So traditionally, testing is really more focused on diagnosis.
Like figuring out which of these best fits the person's experience.
Yes, and then here's a treatment plan. Here are some recommendations,
Referrals.
accommodations, type of therapy to that diagnosis.
If you're looking for any type of psychotropic pharmacological medications, if you think you have ADHD and you're on
Mm-hmm.
medication for ADHD, but when in fact you don't actually have it, that can be a really big deal because we don't want to take
Yes.
medication for a diagnosis or a disorder that you don't actually have. So that's one thing. That's one of the many reasons why I think psychological testing is so important and critical.